Thanks, Danny. It looks like we've got some time for questions and comments from in the room and from the webinar audience.
Bob,
wait, get the mic.
I'm Bob Weaver from White House Youth Services in Cincinnati. A question for Tammy on your PowerPoint slide number 120. The third bullet says the NIDA information can be a new source of data that can provide a national indication of the effectiveness of independent living programs. Can NIDA data provide an indication of specific independent living programs?
No. I think what it can do for states, at the state level, I think states can use it for that purpose. If they collect a lot of what you would call the inputs into that or the services for that. For our purposes, I think it would be much more, can it move that, it can be a barometer, and so can we see better outcomes for those youth who've received certain services? And I can see that at sort of a general performance management level, but not an evaluation of a specific service. No. Does that answer your question?
Mm-hmm.
Okay.
Thank you.
Sure.
Dana Graham with the Confederate Salish Kootenai Tribe from Montana. I was just curious about your survey there in relationship to how reservation communities were being included, the youth from those, since many are independent from the state systems and how those youth are served, and the data is collected separately. Are reservations being surveyed?
Not specifically. There is a question that the state reports of whether the youth is a member of an Indian tribe, but no, they are not unless you. The Indian tribes are not included in this data collection. It's strictly the state agencies.
Leslie Beach from Cloudburst Consulting, and I think this is for Maria, but for several of you about the typology program models. I don't see, and maybe because you didn't have enough room, issues of healthcare as a model element, or so I'm sure these are very wrong words, social interactions, interpersonal relationships, and I'm thinking is maybe they're inappropriate behaviors, but really modeling or learning how to interact with people. So I just didn't know if those were.
Mark, do you remember, I believe we did talk about that.
Yeah, I think we had discussions around health. Part of it was just how do you circumscribe this in terms of specific programs. And so the focus of health was more on behavioral health, which includes mental health and substance abuse, and not so much health per se. And then with respect to relationships, I think part of that fell, so we had long discussions around trauma, and actually the knowledge update, the document talks about that as part of the context here. But I think in terms of the typology, part of it is we're driven by what are the services out there, programmatic services developed in the field. And things like mentoring, behavioral health services, some of the multi-component services have services directed specifically at things like your ability to form relationships, et cetera, as part of engaging in things like employment, education, et cetera. So I think when you see the documents, you'll see that we see some of the things you're talking about as kind of an overlay to all of these things, basically. But we don't see, we didn't specifically talk about a health-related program outside the context of the things, behavioral health, parenting, so reproductive health. So some of these things are captured in the other aspects of typology.
Just because high-risk behavior and working with a lot of homeless youth or youth that are engaged in prostitution, that are HIV positive, et cetera. So I just wondered where those behaviors, are those considered
behavioral health?
Behavioral health?
Yeah.
Even though they manifest or result in...
Well, that term these days, I mean, it's a sort of lingo thing here, but that term is used. I was at a big meeting here in D.C., I can't remember, somewhere, Bethesda, with folks from SAMHSA and Mel, but basically that using that term to describe a very broad range of risk behaviors, and so that's the sense in which we're using that term.
Hi, Garrett Fryer from the American Youth Policy Forum, and building off that question with Tammy, you said that mentoring might be low due to coding in the graph, and where else might it be coded as then with the other words there? And also, I might just be missing it, but is behavioral health also missing in there in the graph, or no? Or it's 120 up there, but it's 119 in our.
Thanks. Yeah. No, we don't have any. There aren't any specific behavioral health services that are categorized as behavioral health. So that the database does not collect, the state does not report services under that domain necessarily. For the mentoring, there have been, and this is anecdotal, and I apologize for that. I don't have any sort of hard data. It's sort of what we've heard at conferences that the states don't.
The definition in the regulation for NIDed is very specific. It says that a state has to have provided a young person with a trained professional for the purposes of mentoring. So if you think about those informal mentoring relationships, that shouldn't be counted as being provided by the state, because if that person hasn't been screened and is being provided appropriate support services, that doesn't meet the definition.
Correct. Thank you. That was said much more eloquently than I did.
In doing our site visits with the NIDed data, we do know that states are confusing a little bit the information around academic support and post-secondary academic support. There's very specific information, and when a caseworker goes to check that, it may not be intuitive which one they should be checking. So if you're helping a young person think about going to college, that doesn't count as post-secondary support because they're not actually in college. So that would count as academic support. So a lot of the things that we've been doing is making sure that states have the protocols in place to make sure that caseworkers know what they should be checking when they're providing the services.
Wendy Henderson from Wisconsin. Do you know of any states that are using NIDed outcomes for a performance-based measure for their independent living program, or any states that are considering moving in that direction?
I think there are a number of states that are doing it. I can say offhand that I know Virginia posts many of the reports on their website. I think Ohio has a couple up there. I'd have to look, but a number of states are. And if you go to the APHSA website, I think you'll see a lot of the. You can get a link to each state's child welfare administration system, and all their reports and publications are on there, and you can see the states that are using it. But many of them using them internally with their own internal dashboards. And then many of them are also publishing their reports up to their websites. And I don't have a list in front of me, sorry about that.
Wendy, I think you asked me a good question. I do think there is a role for that, and in doing our site visits, talking to states, I think it's an important point. So if you have policies and procedures in place that every youth after the age of 16 receives an independent living assessment annually, then you should be able to look at your NIDed data and see where that information is meeting 100%, since that's the standard that you expect in your state. If you have young people who are unable to take the survey because you're unable to locate them within 45 days of them turning 17 in your foster care system, what does that mean about that young person's risk factor that you can't locate them? So I do think that there is a role for that. I just think that at this point, we're still continuing to work with states to make sure that they're giving us encrypted data and that they have the ability to match their data from NIDed to the AFCAR system, which is, I think, another important piece of this. And I know Virginia and some other states have actually done that and see where their matches aren't working so that they can make sure that they have, at the state level, this full continuum of looking at the young person and their trajectory through the foster care system, including that of receiving independent living services and then also of that survey data.
I think this is the only place we're collecting a number of these outcomes, and so it's the only way that we're going to find out, particularly at the 19 and 21-year-old mark, from a broad group of kids. And in Wisconsin, we're surveying everybody at 17 when they're in care, so we have a huge, once our participation rates are in order,
Right.
big group
Yeah, exactly. Many states are serving all 17-year-olds, and some are doing it every year. Like, we only require it every couple of years, right? And as Catherine was saying, that the ability to link is very important. And currently states, I think I have like a 97% match of the NIDA data with the FCARS data. So all the states are pretty much capturing all their kids with the right IDs. So we'll be able to get a very nice longitudinal look at the ECU pretty nicely.
The other thing that's really exciting about this is, I think we're finding more and more, if you ask young people and you give them a space to tell you in a way that's a protected information, they'll tell you how they're doing. They'll answer questions. And, I think in other places, that's not so much the case. And I think that's why, really thinking about how we're designing the system to ask young people and really hear what they're saying, and then based on that, providing services that are appropriate to them. Because I do know, like in Mark's study, one of the things I'm always struck by is the number of young people who are asked, are you ready to age out of foster care? And they will tell you no. And, if we just ask our young people what they think, what services that they need, how that then informs the type of interventions that we're developing. Because if young people don't like what we're developing and what we're providing, they're not going to utilize them.
Yeah, just as an aside, having asked that question for 20 years now, or questions like that, I'm really struck by what you get by just asking young people a variety of things, what they think they're ready for, what they need. I have a series of questions I used to call the cruel hoax questions. Now it's not so cruel, but do you expect to return to the child welfare system after you turn 18 for help in the following areas: health, housing, employment, etc. And I started asking those questions in the early 90s, and over half the young people in Wisconsin said yeah. And they were absolutely wrong about that. There was literally nothing for them to return to. And if the adults in the room, us, the professionals, typically would say, they don't want to have anything to do with us. I went to meeting after meeting where that was said. And it's only when I started presenting data and, they said, actually, half of them expect you to continue to care for them after they're 18. Or in Illinois, where 80% of the young people are still in care at 19 and 50% at 20, that stopped happening, where the professionals stopped coming in the room and saying, well, we don't really need to provide services after 18 because the young people hate us and they don't want it anyway. So I just can't, I got to echo what Catherine's saying there. And also, at 17, I think your point is very important. Those 90 questions, they're limited, but they are the only data we have systematically collected on all kinds of aspects of well-being of people in the child welfare system. Now, they are 17-year-olds, but if you want good data on well-being across a number of number of domains of young people in your child welfare system, just do a good job of complying with NIDA, and you'll have that. That's a question in the back there.
Hi, it's Mary again from New Jersey, representing National Resource Center for Youth Development, and I just would like to know, for all of these different projects, how many of you guys are actually including alumni or youth who are actually interested in participating?
So the planning grants that were just funded have a requirement to have young people involved in the planning process. That's going to look a little differently across each of the different planning grants. And we really do see that as part of the framework, which is talking about positive youth development and thinking about how do you have young people at the table being partners in the work. The trick is always that I think we all recognize that the young people who have the most capacity to come to the table and be at the table with us and think about the planning are the ones who are most likely to succeed. And how do we get those young people who are the most at risk or the moderate risk at the table in a meaningful way to help us inform the services? So in the child welfare field, I think is, in terms of youth services, is really struggling with that, because those are the young people we need most at the table. And I still don't think we figured out how to get them at the table in a meaningful way.
So with the development, there we go. So with the development of the intervention model, there were different pieces that had youth involvement. When we first developed the model, we actually vetted with people in the field. So we got some feedback from them and questions, and so that was really helpful. We will continue to do that. not only ACYF, but all of the other partners as they talk about and try to implement the intervention model. With the SAMHSA expert panel, we had a really unique opportunity in talking about trauma-informed care. We had ride providers, we had trauma experts, but we also had youth, and there was a SAMHSA staff person who'd been a formerly homeless youth who really had, you know how it is, sometimes kids are brought in, they're trotted out, you know, they're not prepared, and then afterwards there's no one to help them process that experience. Whatever feelings came up, he did an absolutely beautiful, it's the way that you should do it. And we had a range of kids. We had one of those, she was in law school, you know, she had been, she rather than not be with her sibling, they became home, you know, she didn't want to be separated. So we had one that was really high functioning, someone that was in the middle, and a youth who was currently in a program really struggling. His caseworker was there with him. You know, he was in and out of the room. And, you know, it was supported. So more opportunities like that, we're going to try to involve youth.
One last question. We got that mic.
Just a quick question on the post-secondary educational support. Does that include remediation rates? Remediation, so once they get to post-secondary places, does that include their need for remediation? Because often there's lack of educational stability as they come up through. So I'm just curious if post-secondary educational support includes remediation rates.
Only if the state were then to provide a service to be able to keep that young person in the post-secondary institution. So if they provided a service under that, they would do that. But the categories for NIDED are very broad. And that's one of the things that we've really worked with states to think about, is that while there's the questions out there that you're required to ask under the federal regulations, if there's more information of things that you want to know, how do you then use NIDED as your way to kind of pair it with that and then collect other information? So, and you know, I do think you have a very important point of thinking about that needed service for our young people, but academic support and services is one of the highest categories in NIDED.
It is.
I appreciate it. I just want to give some sympathy and support to my federal colleagues in implementing NIDED. But one of the challenges, and I think folks in this room would really appreciate it, of trying to capture information on services provided is who provides the service, right? I mean, if a lot of states contract out, and so, you know, fair enough, the federal government might want to require that you somehow capture information from your contractors. But again, this notion of corporate parenting, I mean, having all these other players at the table, whether it's education, housing, et cetera, a lot of that work is going to be provided out of the goodwill of folks in communities, which is what we want. How you capture that in a accountability system for the child welfare system becomes a challenge then, right? So I think I think seeing it as an iterative process is really good, and it's great to hear that that's the way the federal government views this data system. So we now have time for a break. Thanks everybody, and we'll reconvene at 3:30.